That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a conversation in which a surgeon discussing about a scoliosis patient with a nurse in the recovery ward. Now read the question.
Good morning, nurse. How is our patient with scoliosis doing in the recovery ward?
Good morning, doctor. The patient is doing well. They are currently resting comfortably.
That's good to hear. We performed spinal fusion surgery to correct their scoliosis, so I want to make sure they are comfortable and that their pain is under control.
Yes, doctor. We've been closely monitoring their pain levels and administering pain medication as needed. The patient hasn't reported any significant pain since coming out of surgery.
That's excellent news. I also want to make sure that their vital signs are stable and that they are not experiencing any complications.
I've been monitoring the patient's vital signs every hour and everything seems to be within normal ranges. The patient has been resting quietly and I haven't noticed any signs of complications so far.
Thank you for the update, nurse. Keep a close eye on the patient and let me know if there are any changes in their condition.
Will do, doctor. Is there anything else I can do to help the patient?
Just make sure they are comfortable and that they are getting the rest they need to recover. I'll check in on the patient later today to see how they are doing.
Sounds good, doctor. I'll make sure they are well taken care of until then.
Now look at question 26. You hear a conversation in which a trainee doctor asking supervisor advices about balancing patient care with administrative tasks. Now read the question.
Good morning, Dr. Smith. I wanted to talk to you about balancing patient care with administrative tasks. I feel like I'm spending a lot of time on paperwork, and I'm concerned that I'm not spending enough time with my patients.
Good morning. Yes, that's definitely a common problem for doctors, especially in the early stages of their career. What specific administrative tasks are you struggling with?
Well, I spend a lot of time documenting patient care in the electronic health record, which takes time away from interacting with my patients. I also have to keep up with coding and billing requirements, which is a whole other set of tasks.
I understand. Documentation and coding are important parts of the job, but they can certainly be time-consuming. One strategy one uses is to try to document patient care in real time as much as possible, so that it doesn't pile up at the end of the day. I also try to delegate some of the administrative tasks, such as coding, to support staff whenever possible.
That's a good idea. I also find that I'm spending a lot of time answering emails and phone calls from patients or their families, which can be distracting and time-consuming.
Yes, communication with patients and their families is important, but it can definitely eat into your day. One strategy one uses is to block off time during the day for returning calls or answering emails, so that it doesn't interrupt patient care. It's also important to set clear expectations with patients and their families about response times and what types of communication are appropriate.
That's helpful. I'll definitely try those strategies. Do you have any other tips for balancing administrative tasks with patient care?
One important thing is to prioritize your tasks and focus on the most important patient care tasks first. You may also want to talk to other doctors or support staff to see if they have any tips or tricks for managing administrative tasks. It's important to remember that balancing patient care with administrative tasks is an ongoing process, and it can take time to find a system that works for you.
Now look at question 27. You hear a conversation in which an eye specialist talking to patient with age-related macular degeneration. Now read the question. Good afternoon, Mrs. Johnson. It's nice to see you again.
Good afternoon, Doctor. Thank you for seeing me.
Of course. How have you been doing since our last visit?
Well, I've been having some trouble with my vision. It's become blurry and distorted, and it's been affecting my ability to read and recognize faces.
I see. It sounds like your age-related macular degeneration may be progressing. Have you noticed any changes in your eyesight over the past few weeks or months?
Yes, it's definitely been getting worse.
All right. Well, we'll need to take a closer look at your eyes to see what's going on. I'm going to perform a few tests, including a visual acuity test and a dilated eye exam.
Okay, sounds good.
Based on your symptoms, it's possible that you may have developed either dry or wet age-related macular degeneration. Dry age-related macular degeneration is more common and progresses more slowly, while wet age-related macular degeneration is less common but can lead to more rapid vision loss.
What causes age-related macular degeneration?
The exact cause is unknown, but it's more common in older adults, and there are certain risk factors, such as smoking, high blood pressure, and a family history of the disease. There's no cure for age-related macular degeneration, but we have treatments that can slow its progression and help preserve your vision.
What are my treatment options?
Depending on the type and severity of your age-related macular degeneration, we may recommend dietary supplements, injections into the eye, or laser therapy. We'll discuss the best options for you based on the results of your tests.
Okay, thank you, Doctor. What can I do to take care of my eyes at home?
There are a few things you can do to help slow the progression of age-related macular degeneration and take care of your eyes. Eating a healthy diet that's high in green, leafy vegetables and fish, getting regular exercise, not smoking, and protecting your eyes from the sun with sunglasses or a hat can all help.
Thank you, Doctor. I'll make sure to follow your recommendations.
You're welcome, Mrs. Johnson. Let's get started with your tests and come up with a treatment plan that works best for you. Now look at question 28. You hear a conversation in which a nurse asking a colleague for help with a patient with schizophrenia. Now read the question.
Hey, Sarah, do you have a minute?
Of course, what do you need help with?
I'm working with a patient with schizophrenia, and I'm having a difficult time communicating with them. They seem to be experiencing a lot of delusions and are very anxious. I was wondering if you had any tips on how to approach them.
Sure, I'd be happy to help. Have you tried using a calm and reassuring tone of voice when you speak to them? It can help to ground them in reality and reduce their anxiety.
Yes, I've tried that, but it doesn't seem to be working. Do you have any other suggestions?
You might also try validating their feelings and acknowledging their experiences, even if you don't agree with their delusions. This can help to build trust and rapport with the patient and make them feel more comfortable with you.
That's a good idea. I will try that and see if it helps. Thanks for your help, Sarah.
No problem. Let me know if there is anything else I can do to assist you. We are all in this together.
Now look at question 29. You hear a conversation in which a senior nurse is talking about a new chronic disease management program that has been introduced on the ward where the nurse works. Now read the question.
Good morning, everyone. I wanted to take a moment to talk to you about the new chronic disease management program that has been introduced on our ward. As you all know, many of our patients suffer from chronic conditions, and it can be challenging for them to manage their health on a daily basis. That's where this new program comes in.
That sounds interesting. Can you tell us more about it?
Absolutely. The program is designed to help patients with chronic diseases, such as diabetes, heart disease, and cancer, manage their conditions more effectively. We'll be working with patients to develop personalized care plans that take into account their unique needs, goals, and preferences.
That sounds like it could be really helpful for our patients.
Yes, we're hoping that it will improve patient outcomes and reduce the risk of complications and hospital readmissions. In addition to the care plans, we'll be offering education and resources to patients to help them manage their conditions and improve their overall health.
How will we be involved in the program?
As nurses, we'll be playing a key role in implementing the care plans and providing education and support to patients. We'll be working closely with the rest of the healthcare team to ensure that patients receive the best possible care and that the program is a success.
That sounds like a really valuable initiative. I'm excited to be a part of it.
We're really excited about it too. We believe that this program has the potential to make a real difference in the lives of our patients, and we're looking forward to seeing the impact it has on our ward.
Now look at question 30. You hear a conversation in which two speech pathologists are talking about a new speech recognition software that's designed specifically for speech therapy. Now read the question.
Hey there. Have you heard about the new technology that's being introduced in our field of speech pathology?
No, I haven't. What is it?
It's a new speech recognition software that's designed specifically for speech therapy. It's supposed to be a game changer in terms of helping patients improve their speech and language skills.
That sounds interesting. How does it work?
Well, the software uses advanced algorithms to analyze a patient's speech patterns and provide real-time feedback on things like pronunciation, intonation, and pacing. It can also generate targeted exercises and practice materials to help patients work on specific areas of their speech.
That sounds like it could be really helpful for our patients. Do you know if it's easy to use?
From what I've heard, it's pretty user-friendly. The software is designed to be intuitive and easy to navigate, even for patients who may not be tech-savvy.
That's great. I am looking forward to trying it out. Do you know when it will be available?
I'm not sure of the exact timeline, but I know that the company that developed the software is planning to release it in the next few months. They are also planning to offer training and support to help speech pathologists get up to speed on how to use it effectively.
That's good to hear. I think this could be a really valuable tool for our practice, and I'm excited to see how it can help our patients improve their speech and language skills.
Me too. It's always exciting to see new technologies being introduced that can make a real difference in the lives of our patients.